Well, a petition to stop the Ontario government from passing new healthcare legislation has now collected more than 15,000 signatures. Two groups, the Coalition of Ontario Doctors and Concerned Ontario Doctors, are out to stop Bill 41 from being passed later this month. The doctors say they were never consulted, and if the bill is passed, it would mean government investigators would be able to access your medical records without your knowledge or permission, as well as add more bureaucracy to the system that will take money away from patient care. The doctors will be holding a rally this Sunday here in Ottawa in advance of the Vanier by-election November 17th. Dr. Kulvinder Gill heads the Coalition of Ontario Doctors, and she joins me now from her office in Toronto. Dr. Gill, good afternoon.
Thank you for having me, Caroline.
So, Dr. Gill, tell me, first of all, you're coming to Ottawa. Is it just about Bill 41, or is it just to get your message about a range of issues here in Ontario that the doctors have a problem with the Wynne government?
We are attempting to highlight the ongoing healthcare cuts at the hands of the Ontario Liberal government. As many patients are not aware, the Ontario government has cut nearly $1 billion from the patient services that their doctors provide since January of 2015. This has actually led to the closure of over 200 family doctors and specialist clinics. Nearly 1 million patients in the province are currently without any family physician. And what we're seeing now is that these patients are now flooding ER rooms, and we are experiencing ER code gridlocks across the province. This is when patient care needs actually exceed the hospital resources, and we see patient stretchers parked in the ER hallways. We see ORs canceled, and we see elective or diagnostic procedures canceled. Ultimately, what ends up happening is that patients wait longer and longer for care. Mm-hmm. Presently, the wait list for several specialists in the province has now grown to nearly 2 to 3 years, which is completely unacceptable.
Premier Wynne continually says that they put more money into healthcare than any other government. Can you address that? I mean, the opposition says that's not true. They keep saying it, though. What is in fact the truth? Is it what you're saying, that the $1 billion has been pulled from the system?
Not only has $1 billion been pulled from the physician services, but thousands of nurses have been laid off across the province, and the hospital budgets have been frozen for years. What we are seeing with this government is an attempt to buy votes through building infrastructure for hospitals, but then they don't actually fund the nurses and doctors that are required to staff these hospitals. So you see hospitals which have empty beds. You see ER stretchers lined in hallway corridors. You see operating rooms standing empty. Lights completely turned off while qualified surgeons, are actually leaving the province because they are unemployed. Not because there is no demand, there are wait lists for years, but because the Wynne government is presently rationing patient care.
Now, your organization, the Coalition of Ontario Doctors, and this other group, Concerned Ontario Doctors, you work together. These organizations sprung up because you were unhappy with the contract that the Wynne Liberals were trying to hammer out with the OMA. But you decided to continue working because you're feeling very, very passionate about what's happening in the province. Is that a good way to put it?
Well, Concerned Ontario Doctors has actually been around since October of last year when the cuts escalated. And the Coalition of Ontario Doctors was formed this summer to fight the terrible contract that this government was putting forth, which was going to force doctors to actually ration patient care. So it sprung from a grassroots effort in an attempt to put an end to the madness, essentially. And now Bill 41 is our next battle. And what's very alarming about this bill is that it will change the face of healthcare forever as we know it.
Can you explain what exactly do you mean change the face of healthcare?
Presently, there are LHINs that exist. No one really knows what they do. They're essentially there as like a middle management. They're not involved in any patient care. And the Auditor General actually criticized the LHINs as them not showing their worth. And they cost taxpayers nearly $90 million every single year when they're not directly involved in any sort of patient care. Now, the Health Minister Hoskins is planning to expand, and each of these LHINs will be expanded into sub-LHINs with 80 to 90 new sub-LHINs created. There's no exact dollar amount that they have assigned to this, but it's anticipated to cost taxpayers millions more into this bureaucracy. Not many patients are aware, but Ontario spends more on bureaucracy than any other province in Canada and any other country. We have 10 more bureaucrats per patient compared to Germany. So most of our healthcare taxpayer dollars are not going to frontline care, which is where they are needed, but are going towards the expansion of this bureaucracy.
So that costs money. One of the things I was talking about in this bill was the access to medical records. That has your concern too. What's going on there?
So presently, the only person that's allowed, that's legally allowed to access your patient or your patient medical records is your family doctor and any other specialist directly involved in your care. Any other physician that wants to access your patient records needs to get your permission first. And if there's any third party, they need your written permission. The only other time when there would be access to your medical record without your consent would be through a court order, through a warrant.
And this bill would change that?
Absolutely. So with this bill, government-appointed bureaucrats can enter into any premise and start investigations. And they can go through any medical record, they can go through any of the clinic, hospital records, etc., without any prior consent of the patient, of the physician, or any of the healthcare providers.
So you've got how many signatures on this petition asking the government to reconsider this?
As of this morning, we have over 15,500.
And the petition, can anyone sign it?
Absolutely. Anyone here in Ontario can sign it.
How do they find it?
They can find it on CareNotCuts.ca.
CareNotCuts.ca. So that will be, I guess you'll have the petition here in Sunday. Sunday is the rally in Vanier. Tell me about that. What's going to happen?
Yes, so we are holding a rally across from the Liberal candidates' campaign office to highlight the ongoing healthcare cuts, which are creating a crisis in this province, and to highlight Bill 41. Physicians, patients will be rallying together to create further awareness. We want voters to be aware as to what the Wynne government is doing to their health care, and we want them to be fully informed before they elect their MPP, who will be their voice at Queen's Park.
Have you had response from the candidates running in the Vanier by-election? Are they going to be there?
We have reached out to all of the candidates for our all candidate healthcare town hall and debate that we're holding on Monday, and that's Monday evening from 7 to 9. And we have invited all of the candidates. Thus far, the NDP and PC candidates have confirmed, despite 2 follow-up requests, we still have not heard from the Liberal candidate.
Do you find that funny?
They skipped out on our healthcare debate out in Scarborough, Rouge River as well. There we had the PC, the NDP, and the Green candidates attend. I think we have very few opportunities in our electoral system to hold our elected officials to account during the 4-year election cycle. And Ottawa-Vanier has that great opportunity right now. And this is their chance to finally hold those that they have elected to account, and we are finding ourselves with the Liberal government that has become arrogant. They are involved with so many scandals. There's been so much mismanagement, and the only ones that they will be held account by are the voters. And Ottawa-Vanier needs to be well aware of the impact of the Liberal government's cuts on their health care, because it's going to be impacting their ability to find a family doctor. It's impacting their ability now in terms of actual wait times to see a specialist, in terms of ORs. Healthcare is the one provincial mandate in our province that impacts every single citizen from birth to death, and we cannot allow this government to tear our public healthcare system apart.
Remind me, how many doctors do your groups represent in Ontario?
We have, so the Coalition of Ontario Doctors is actually made up of thousands of specialists and family doctors from every corner of the province. So
Sunday in Vanier I just want to get people to, if people are aware, where should they be at what time?
So out in Ottawa-Vanier, we're having the rally on Sunday from 2 to 3:30 across from 233 Montreal Road, and that's in Ottawa. For those that are in the GTA or the Hamilton area, we also have another rally happening in the out in Stoney Creek for the Niagara West-Glanbrook. A by-election that's happening as well.
Well, Dr. Kulvinder Gill, thank you for telling us about it. Good luck.
Thank you so much for having me.
Okay.